When we started this journey, we were trying to understand patient satisfaction. We were trying to solve problems without ever really asking a parent what the issues were. We thought we could come up with those answers without necessarily asking, well, what was your experience?
Myself as an administrator, I have a good understanding as a family member, as a parent, and as an administrator of the needs of kids, but until I've been there, I don't have the full embracement of what those opportunities are. So why wouldn't we ask our patients and our families, should I say, how they see things and how it's viewed from their worlds, and combine it with my understanding to come out with an overall better outcome.
Family-centered care started out as a safety and quality initiative. They recognize that in not just treating the patient, but providing support for the entire family empowers the family. It educates the parents on how to be a better healthcare provider for their child when the nurse and the doctor aren't around. So those also improve outcomes.
It just doesn't make any sense to not make care family-centered. I mean, they are the people that you're taking care of.
We think it's very important to involve the families in the care of their children. In fact, if the parents aren't willing to be involved, then we don't feel like we'll have much success with the child.
Here at Cook Children's, we try to involve the families as much as possible in the care of their children, and so we need to spend a little extra time with our education and our tools that they can use once they go home, because we're not going to be there 24/7.
Every shift, whether it be the nurses, the care partners, they all taught me what it was to do to care for my daughter. Even when there was no plan of us going home, they still guided me through to know and to teach me what they were doing so that I didn't feel left out.
As a parent, I find it reassuring that no matter what type of question I have, that they're always willing to help us understand the situation a little bit better. With all of the physicians that we do see, with them being able to collaborate together to come up with the best care plan for her is very reassuring.
The parents are able to talk to all the different disciplines that are involved in their care, which could be an RN, a respiratory therapist, a physical therapist, occupational therapist, and of course the physicians. We have so many people that are involved in the care of each patient here. The parents have input into all the discussions we have if they would like to participate in that.
There are several things that we have done to involve the family. One is asking the parents to really give us input twice a day on how their child is doing and what their concerns are. It tells us when in the parents' eyes their child is not right, getting worse, they have concerns.
We actually ask the parents to come out of the room and join rounds in the ICU, and so that they can hear everything going on in the care of their child. I think on the physician side, that provides some trust in the family, that they see all the decision making going through, all of the collaboration between the different teams and the different allied health services that we have here.
I think that they're very open to hear what we have to say because we are with her 24/7 and they see her for a brief period. They really do value what we say, and it's evident with the way that they practice their medicine.
At Cook Children's, in our transitional care unit and in our neonatal intensive care unit, we have all private rooms, so we feel that encourages the parents to stay, be involved in their child's care, as well as have some privacy.
The majority of our rooms are private rooms for families here in the NICU. It's important that families have the opportunity to stay together. In those multiples rooms, we have a bed so that parents can stay the night.
I often had signs that were up to say that please knock before you come in, or, you know, especially for the male staff, because I would have to wear my hijab, which is my scarf, and I always got that respect. It didn't matter if it was a doctor, male doctor, or nurse, or anybody. They were always very respectful.
One of the areas that we focus on is the siblings. What are brothers and sisters feeling about their brother or sister being here?
Cooks became my family. The staff became my family. Doctors knew me differently. They respected our family. They respected our values.
I think all of our staff are very committed. You don't come to work at Cook Children's unless you're totally committed towards the cause, and that's our patients and families.
We want them to know that we really do value them as part of the healthcare team. Yes, they're the parents, but they're one of the most important parts of that healthcare team.
It's not over here in a medical model that knows everything, and it's not in parents that are always going to be right necessarily, but it's this piece that happens in the middle where they come together, and it's a patient, but it's a child, and it's a concern that both parties meet in the middle. And so understanding collaboration from that perspective has been very helpful for all of us, because it really was understanding that it takes two parties to really treat the whole child, which is what family-centered care is all about.